Welcome back to the Last Visit First podcast live at Home Care 100. On my left here is Charles McDonough. He is the CEO and president of Delaware Hospice. Welcome to the podcast, Charles.
Appreciate you having me here, Tom. Thank you.
Yeah. So what are you doing here?
So again, been at the conference for the past 6 years at this point. Always love coming to be able to make the relationships and understand what happens, because what happens in this industry is founded here. A number of things that you see these solution providers, and we've talked about, I've been excited to be at the table and just be thankful to have the conversation, and excited to learn what more innovation we can bring to the market and how we can continue to move and grow this thing.
Well, that's awesome. How many years? This is your 6th year coming here?
This is 6th year, yeah.
Yeah. So what's the big theme you see today?
So the big thing we're hearing here about the conference is about the data and using the data to be the imperative. And I think that while we need to leverage the data and make it valuable and make it meaningful, I think what we're talking about around the tables or around the conference sessions is really how do you make it meaningful from a health equity impact endpoint. Just listening to the session you were in yesterday about talking about intelligent care and how we've really got to knock these things down. That is what is imperative, I think, for us to be able to do. And some of the conversations we're having about how do we actually do it is, I think we're on the precipice of being able to make it happen. So I think hearing that, seeing it, talking about it, I think is what's going to take us where we need to get.
Yeah. All right. Tell us about Delaware.
Yeah. So Delaware Hospice. So we are, the first hospice in the first state. So I've been around 42 years.
Wow. That's funny you can say that.
It is. It's interesting little history fact. We're also the only community care provider that covers every zip code in the state of Delaware. And we've just bridged over into the area in Pennsylvania. We're a hospice provider, first and foremost, but we've also gotten into ACO collaboration. We've got some upstream partnership and ownership there, as well as we have a day center for hospice inpatient dementia respite. And we're a certified guide provider that complements our physician and palliative services.
What town is it in Delaware?
So we're primarily based in Newark, up in the north part of the state. But again, we've got offices peppered all the way across.
Fun fact, I've been to every state in the United States, and Delaware only one time in my life.
Come on.
I know. I need to come visit again. What's your big focus in 2026? What are you working on?
So our big focus is growth and innovation. Certainly everybody has got, headwinds that they're having to deal with on the financial front. But really developing our partnerships and our scale strategies coming into 26 and 27. We've got some interesting ideas that we are going to market with, specifically around our dementia and our cognitive patients. There's so much in this country that those patients get lost or not taken care of because either, the clinicians don't have the acuity to handle it, or there aren't resources available. And so, we've gotten pretty bullish on our dementia care program and continue to focus on that, as well as, just really trying to bring the whole healthcare piece home. Something we've been seeing and hearing a lot of lately is that there's just not enough healthcare for healthcare at this point. So when we see, look in Southern Delaware, even some of these rural areas, being able to talk about with state officials regarding the rural transformation program on how are we delivering these funds? How are we going to make care happen? How are we going to be virtual first to be able to connect patients to care? It's what we deal with every day. And it's, thinking about it differently that I think is it's going to be a big focal point for us this year.
That's awesome. If you expand which direction you want to go, you can only go west.
Yeah, so
you can only go east.
It'd be a little interesting to go out into the ocean, but you're definitely focusing on contiguous states and where we're at. But we are also putting on the roadmap, are there additional partnerships in other states that we'd be able to target, as well as collaborating with our other not-for-profit hospice, partners in the area, because the not-for-profits hold a special place, I think, in the post-acute, arena's heart. There's a lot of things that are done there, but, I think collaborating with them as well as the health systems, because, healthcare philosophy transcends all other things that, we tackle on a daily basis. But, really focused on the Pennsylvania, Maryland markets, as well as partnerships there for people that are willing to have them.
Recruiting and retention. Talk about how do you find nurses? How do you find therapists, aides?
Yeah, so
social workers.
You would think that in an area that's right next to Philadelphia metro markets, it'd be easier. It is absolutely not. Retention has been, a big focal point for us. We do relatively well, but focusing on how do we continue to improve. And some of the partners here are talking about, how are you getting really excited about, recruitment rewards and recognition. So putting a big focus on that from an education and from a recruitment standpoint, really focusing on how do you grow from within, right? You got the human capital equity with your own team. So if you can take an aide to an LPN or an LPN to RN, how do you upskill them in that way so that they also want to stay and grow along with you? And, that's been a big focus. And I think what we're really excited about as well, for the first time, the Rural Transformation Program is allowing the state of Delaware to have its first ever nursing program in the state, independent from the educational facility. So standing that up starting this year and being a partner with that, and allowing people that go to school, stay in service with our areas and give them a pathway, to a job right out of college.
I was having a conversation last night with a couple ladies that are nurses, and they were talking about how do we recruit more nurses, right? We have 400,000 nursing shortage or whatever the number is. And one of the ladies said something to me that it was interesting. I want your opinion on this. They said that the states control the nursing certification or the licensure, and they're the ones holding back, not the colleges. So people want to go to nursing school, they want to go to college, and they want to be graduate as a nurse, but because the licensure process for the state is we only allow X number of licenses, so they're actually holding back the community. And this one lady said that she believes that they're doing it because they want to keep the salaries high for nurses. If they just open the floodgates and let all nurses, anybody be a nurse, they'll drop the salary. But what your thoughts around that? Any opinion on it?
I mean, it's
wild though, right?
It's supply and demand, right?
Yeah,
and so
I was blown away by it.
There are certain states that have been a part of operating in, and they do absolutely limit the nursing to teacher ratios because they want to try and do a good job, et cetera. There is definitely an economic impact, because if you have a significant larger pool of resources to pick from, the organizations can choose, what the demand changes, right, versus the supply. So the economics are different. So I've not thought of it in that lens, but it definitely makes sense when you sit here and talk about it. Just even, where, we're at in Delaware, the southern part of the state, you wouldn't think that it cost more to employ a nurse there,
Right.
but you've got to bring somebody in, you got to move them down there, you got to keep them to want to stay there. You're building infrastructure around them. So either the hard cost and or the soft cost, it's about moving them where they are. And that's an interesting concept. I've not heard that one yet.
Me either. I was in my third martini, so it was like, oh, okay. And then I started thinking about it more, and then I woke up this morning thinking about it. I'm like, in California alone, we're dying for nurses.
Oh yeah,
we need so many nurses, and you can't get them, you can't find them. And then they're like, they only let so many go through the system every year. And I'm like, why would they not release that? Why would they not change that?
Yep.
And it's controlled by the nursing school or the nursing board,
right,
which allows the nursing schools to only produce so many nurses.
That's right.
It's pretty bizarre. And then, the other thing, and this lady and I, we had a great conversation. I'm not going to tell you her name, but she'll listen to this and know, is the whole, if I'm a nurse in California, I can't work in Nevada, or I can't work in Colorado. And why? If I'm a doctor that's a certified doctor and I went to school and I have a doctor's degree and I'm licensed, why do I have to be licensed in every state?
Yep.
And I believe that's a problem.
Yeah.
If we have this big supply and demand problem, why wouldn't it just look?
100% agree with you. I mean, it's the ability for us to not be able to move, or some of our most valuable, really resource to take care of patients from state to state, to be able to help them. What I found interesting though, is that, from a state legislator to be able to say, if I want to go practice from here to here, but if there's some sort of crisis or a strike and these staffing companies can somehow just pick everybody up and move them to an area and location, it's interesting how easy it is for some and others to be able to move around versus, if you're, trying to do it yourself. And, so even just in between Washington and Oregon, like there's a waiver list that you can't get. They're not compact, so you can't get your licensure through. But if you happen to put your name on the list, they'll overlook it until you actually get to, the point of licensure. So I think, all states ended up being to be compact states if there was a universal, nursing requirement. And I think that's true of any clinical discipline. If you get your license, go work.
Dr. Oz, fix that for us, will you?
Right.
I know he listens to this podcast, so got to fix that. It was just bizarre. I have this, and she's an ER doctor, Dr. Danielle, who's going to be on the podcast here in a couple of weeks, and she worked for a credentialing company and is medical marketing, and she's just so frustrated with this, and so she's lobbying for it and all this. So she's like, I'm an MD. I work in the emergency room, and I can't go across there's a river between her house and the next city over. And she's like, I can't go across the river and see a patient in a crisis, an emergency. If there was a disaster over there, she's like, I can't do it.
Yeah,
it's crazy. So anyway, all right. What else? If I want to get a hold of you, Charles, how do we get a hold of you?
So easiest way to get a hold of us at the organization, DelawareHospice.org. You can get a hold of us there. Find more about us now, and any one of us will be able to reach out to you.
Perfect. Anything else you want to share?
Just excited to be here and excited to see all the innovation that occurs here, and would just challenge myself and all my colleagues to really just continue to rip down barriers and figure out how we work together. I believe that's the only way it's going to work. And, we need to make more healthcare for healthcare, so we actually provide that versus sick care. So the more we can work together, the better off we'll be.
Thank you for being here.
I appreciate you having me.
All right.